All right, it's Elder Care on this Tuesday morning, and it's time to have that talk. And nobody can advise us better than Dr. Alicia Arbaje from Johns Hopkins University. We are talking about orders today. You see them more than anybody. They come into the hospital, and then what? What do you ask them?
Well, when someone first comes to the hospital, what the medical personnel are going to want to know is, what do you want us to do if you're to get more sick than you already are, if your condition were to get worse? So that's going to be the main thing that people are going to be focusing on, because people have different belief systems about that.
Are you surprised that families don't communicate this? I mean, out of 10 that come in, how many don't have orders?
Well, I guess it's kind of hard to say. Most people haven't thought about these issues or haven't really faced them in a really difficult way. So probably, 3 maybe have thought about it. It just depends on...
It's tough, though.
It's a very hard thing to talk about. Very hard thing to talk about.
When they're healthy, you don't want to bring it up. When they're ill...
You don't want to think about it.
You don't want to think about it.
Right. So that's why it's really important, because all of this is about trying to help patients deal with their illnesses, and for doctors and other healthcare providers to help respect their wishes. So that's why all of this is really important to talk about.
All right, doctor, what kind of questions should we expect?
So when you first come to the hospital, you can expect that maybe 1, 2, or even 3 people are going to ask you, what do you want us to do if your condition is deteriorating? And then who do you want us to talk to if for some reason we can't talk to you? Remember, we will always talk to the patient first, because that's the person who makes the decisions for themselves. At least in this culture, that's how we approach it. But if they can't, we're going to want to know who else can they talk to, and which one individual is the person we need to talk to.
And here's the problem.
Right.
Tuesday I feel this way, tomorrow I'll feel another way.
And that's exactly right, and that's very common. That's why it's important to have these discussions, not just once, but any time there's a change. So doctors and other professionals are going to ask you these types of questions when you first come to the hospital, and then if there's a change in your medical status and your medical condition. And they're going to ask you again when you go from one place to another, when you go from the ICU to the floor, or when you leave the hospital and go to the rehabilitation facility. So the patient may say, but you already asked me these questions, but they're going to ask you again for that reason.
All right, we're going to put it up on the board here, and we're going to read it home so we can follow this.
Okay.
What can you do? All right, let's say you're prepared for the questions. What can you do right now, even before you hit the hospital door?
So think about these issues. Make sure you have picked one person to speak on your behalf. And you may want 2 or 3 people to talk on your behalf, but you really need to pick one person to give those opinions to the healthcare provider. It becomes very complicated when there's more than one individual.
You said live close. Have that person who makes the decisions live close. Out-of-town sibling making calls.
So it's okay if they live out of town, but they need to be able to come and be at your side quickly. So the person who you choose needs to be there, be very available, and be present, because decisions can change very quickly.
All right, you say talk to that person and to the family.
Right. The family needs to understand that that person is the spokesperson. That person can talk to all the other family members. That's fine. But they need to know that that person is the spokesperson. And
don't defer the decision to others.
Right. Many times when I ask my patients, oh, what would you like us to do? They'll say, oh, I don't know, don't talk to me about that. Talk to my daughter.
Right.
And that's difficult, because unless you've had that conversation with your daughter, and unless your daughter is willing to speak on your behalf, that's putting a lot of pressure on that family member.
And be very clear about what you want and don't want.
Right. So doctors and professionals may ask you, well, do you want antibiotics? Do you want chemotherapy? Do you want this and that? Really, what you need to be able to tell the healthcare professional is, what are your overall values? What's important to you in life? Is it to be at home? Is it to have your pain under control? Is it to be able to breathe better? Be very clear about what your values and your wishes are, and let the healthcare provider then help you pick the treatments based on those wishes.
And you said do it now.
Do it now while you can. It's better to do it now. It saves a lot of trouble for family members later, and it can make it a lot easier for you to think about how you cope with your illness in the future.
She's good. You made me feel better already.
Do you? Good.
Thanks for the talk.
Have the talk.
Doctor. All right.